care is basically a healthcare model that is cash pay. Cash, you pay for a membership, but it cuts out insurance. You could use your insurance, but you don't use your insurance for the membership, but you could use your insurance if you choose to for labs or imaging or anything like that. However, with direct primary care, I have very affordable cash pricing, so a lot of times, I ask the patients if they wanna use, their insurance, they can. It's a possibility if they do. I don't really dig too deep because I have worked in the insurance industry and I kind of know what they cover. So for an example, I will tell you that I had a recent patient that wanted to use her insurance but wanted a full functional panel. She was billed $3,200, and that same panel, my cash price is $280. So there is a significant difference. She called me screaming and freaking out what to do. I ended up reversing it and getting it on to my plan, but normally that is something I don't do, so I do let people know that. Some of what is included in the membership, so I'm just gonna pass around so you can get an idea of traditional insurance versus what is included if you become a member. It's kind of explained, here is some idea if you become a member. Most of the testing, like your strep testing, your abscess drainages, if you have a rash, we do some derm. A lot of that kind of gives you an idea. If you have a UTI or anything like that, you come in the office and you're a member, you are pretty much walking out the office not paying anything. That is all covered under your membership, and there is more explanation on that passing around. We pride ourselves in same day or next day appointments. If you are a member and you have a problem, yesterday I had a guy that was having some chest discomfort. Well, he's a priority, I got him right in. So I guarantee same day or next day appointments. You don't always have to come in for an appointment. Let's say it's something that I could just jump on telehealth because I want to look at it. I could do a telehealth. Let's say it doesn't even need an appointment, it just needs a phone call. I do that as well. Every member gets access to an app. So that app is HIPAA compliant and it gives you direct access to me. You are available to me 24/7, but I do ask that after hours or weekends are for emergencies only. So a lot of times I will get somebody asking, what are your hours? So I no longer jump to those. If it's after hours over the weekend, I kind of wait for my normal business hours to respond to that. But any emergency, I immediately respond to. Most visits are extended. You definitely don't come in and I'm gonna spend a couple of minutes with you. I am definitely gonna sit down, listen to why you're coming in to see me, and hopefully make sure we answer all of your questions. All calls return, so if you call the office, you are not waiting to get a call back. I return all calls the same day. It really depends. Every time somebody calls or sends in a message, I immediately see it because of course I always have my phone with me. If it's something that I need to immediately tend to, I will usually say, hey, if I'm with someone, I will get back with you, but I see your message in a few minutes. Anyone in here that is my client should be able to attest to that I am really quick at responding. Labs are done in the office. Like I said, you could choose to use your insurance. If you choose to use your insurance, the labs still can be collected right there in the office. You can come in and then you will just get billed later, or if you're paying cash, you'll know what you're paying. I usually tell you what I would like to do and what it's gonna cost if you wanna use cash before we even start. I am not one to send you, your labs are done, your labs are all fine. So normally when you get your labs done, I schedule a follow-up appointment. I usually ask for 45 minutes to an hour. A lot of times I'm doing a lot of labs that people don't even understand. So I am really good at it, sitting you down and explaining everything, what this number means and what we need to do to fix it, and giving you a plan. So you'll never get a text from you. Will get a text saying your labs are completed. When do you have time to come in? Let's sit down and explain what I see that's going on with you. Prostate, just all screenings. The reason why I put prostate is because I should not be diagnosing prostate cancer in a 68-year-old that was with a previous primary for 20 years, but I have, right? So preventative care is important. The earlier you catch it, the more options and choices you have to treat it. So please, you know, I am one that I always am gonna talk about your preventative care. Have you had this checked? Have you had that? If you're a member of mine, I definitely make sure that we're on top of your preventative care. And because I don't take insurance, I don't follow the rules. I don't wanna wait to find osteoporosis when you're 65. I wanna see you developing osteopenia and start treating it and tell you what to do to prevent osteoporosis before you're 65. If your PSA is starting to rise, I'm gonna start following that and I'm gonna start watching it. I'm gonna get you to a urologist earlier, because sometimes it could just be prostatitis that can be treated. So I definitely big on screenings. They're important. A lot of other services that I do is I do hormonal optimization with all the different hormones there. I do medical weight loss. I do a lot of IV therapy as well as peptides. I don't know if you guys know what peptides are, but they are a game changer. So they work very, very, very well for a lot of different things. So if you don't know about it and you just want to find out more what are peptides, what they do, I do a lot of peptides. I am very well educated in peptides. I love them. They have a lot of good benefits, so I really like peptides. What is a good referral for me or us? People that are feeling exhausted all the time but thinks it's just stress, struggles with brain fog, low energy, people that gain weight despite exercising and doing everything right, people being told that their labs are normal, and people that want to be proactive about their health. And bringing health back to what matters, and that's you.